So this is a situation of all tooth decayed, only root stump remaining. We'll see how we rehabilitate the maxilla. We'll see the panoramic view. Some decent bone in the premolar molar area. The sinus is not very down. So we'll see the cross section. This is a 2-1 area. Two and 2-3. This is near 2-4. 2-4 is the key area. 2-4 and 2-5. Somewhat some bone is there. This is 2-6 root stump. Even though there is only root stump remaining, above that there is some good bone. So this is right side, central incisor, lateral. This is first premolar, second premolar, and molar also. Palatal aspect there is some good bone. We'll see the post-op cross section. So from right side we will see this is a panoramic section of upper. The patient has shaken the head, so we may see an artifact here. So this is the molar implant, palatally engaged, 10 mm implant, compressive, 4 into 10. This is we are getting support from the nasal floor also, 4 into 14. This is the first premolar implant, which is a key area. This is also getting its engagement from the nasal floor, 4 into 16. All compressive implant. This is the anterior implant. Since the bone is very thin, we have used 3.5 into 14. This is a 2-1, 2-2 area implant, 3.5 into 14. This is first premolar implant getting nasal cortical engagement. This is near the molars, palatal engagement into the palatal socket area. So the last implant is a kind of pterygoid, but it has not gone till the pterygoid. So we can appreciate that near pterygoid implant here. So this is axial section view, which is good for analyzing the pterygoid area. So this junction is the pterygoid. So this implant has gone till the pterygoid but not exited the pterygoid. So it is starting from the second premolar and going near it. So right side we have avoided the pterygoid, left side we have placed the pterygoid. So this is how there is proper distribution of implant, proper spacing in between the implants, totally 4 on each side, 8 implants.